Okay, so till we hit the time of 7:05 and more people will join us, I give an introduction about the COVID sleep team. As you know, COVID has impacted our life in its most horrible phase that we can imagine, followed by economic situation. So I think as I'm telling my researchers, for the next 10 years, we have to do a rigorous analysis and research on each and every aspect of COVID-19, from genetic perspective to environmental factor to even behavior. So why it is important? Because the more information that we have on a global scale, in every aspect of it, will help us if a future pandemic happens, we'll have some kind of database or resources to see how the situation went with COVID-19. Like when we started studying about COVID-19, there were very few pandemic, not on the global scale, within few countries that was our resources. So we start having our stepping stone on very few options about previous pandemics in very few countries. So I will not discuss more about what is the details of it, as the project name says, it's a COVID sleep project. It's an amazing team that they started working from last summer, nonstop, rigorously, passionately on this project. Both researchers that they stayed in the project till today, including this three, as well as those who have been senior and left, or for any reason they could not continue. But I am very happy to lead COVID sleep team. Very excited for them. They submitted their work to one of the most prestigious conference in the world. We are very excited. At least try happen. We'll see if they hear back or not. So they are in the preliminary stage of their analysis. They are way to go in advance to cover more details, but they would like to share a very important insight of their study as of today. So everyone, Avi, Anika, and Ananya, it's all yours.
Thank you for the introduction, Zahar. I'll start screen sharing right now. Okay, good afternoon, everyone. Thank you for joining on time. We're part of the Colloquia Neuro Lab, but on behalf of the COVID sleep team. Our title is Tracking the Correlation Between the COVID-19 Vaccination Status and Sleep Quality. So a little bit about the presenters. My name is Ananya Rabi, and I've been on this team since this summer of 2021 when this research first began. I'm a rising junior at Irvington High School in Fremont.
Hello, I'm Anika Mantra-Pragata. I'm also a rising junior at the Harker School, and I've been a part of the COVID sleep team since the beginning at the summer of 2021.
And I am Avia Pulpati, and I've also been here since last summer when this project started, and I am a rising senior at Doherty Valley High School.
All right, so today we're going to briefly go over the background, then the methodology, then Avi will take over with the results and conclusions. So firstly, I'll go over the background, and I'll briefly introduce a timeline of this project. So during the summer 2021, when this research began, we first started off by compiling a lot of articles and papers from reliable sources such as PubMed, which were relating to COVID-19 and its effects on the general public. Studies included COVID-19's negative effects on sleep, behavioral patterns, and lifestyles. We also researched within these papers outlying factors that contribute to poor sleep quality, such as addictive substances, over-the-counter medication, and stress from following the media to create our eligibility questionnaire. So during the fall of 2021 and spring 2022, we created our consent forms for participants. We requested and received IRBO approval, which included our long and consent forms, and all 4 questionnaires that we designed. We also researched and began real data collection after we collected dummy data so that we could confirm that JotForm, the platform that we're using to collect data, is working smoothly, which is also HIPAA compliant, by the way, now that we're paying. And here are some examples of some of the papers we looked at. To your left, you see a paper that discusses the effect of psychological stress on sleep. And I'm sure most of us would agree that increase in psychological stress causes poor sleep quality, but of course, we always need a strong basis and reliable paper supporting any common knowledge. And in the middle, we see a paper on sleep disorders in students during the pandemic. And to the right, we see a paper that discusses sleep quality among adults in Turkey during the pandemic. So how is our research different than the ones on the previous slide? Well, the main difference is our independent variable, which is the vaccination status. Basically, we're trying to understand the relationship between COVID-19 vaccination status and sleep quality, whether it's a biological, a positive effect, whether it's psychological one. We're trying to determine the effect of vaccination on sleep quality. And of course, our dependent variable is the sleep quality index, which is the score we give to our participants to rate them from good sleep quality to bad sleep quality. Our experimental group is the group that's fully vaccinated against the COVID-19. Our control group is the same group, except they answer the same questions, but before their vaccination date. Our hypothesis is that the sleep quality will have been poorer to vaccination date compared to after the vaccination date. And our rationale is that the vaccine will decrease stress levels, which will increase their sleep quality. Now, my co-presenter, Anika, will go over the methodology.
Thank you, Ananya. So in order to develop our 4 different types of questionnaires, we looked at a lot of existing questionnaires that evaluated sleep quality. On the left is the Insomnia Severity Index developed by Charles M. Morin, and on the right is the Pittsburgh Sleep Quality Assessment, which was developed by DJ Bizey. A lot of these questions were the basis for which we developed our questions to evaluate sleep quality. So we had 4 different types of questionnaires that the participant filled in order, and I'll go through them in the order that they filled them out. So we start off with the consent form. We had a long version and a short version, and according to the Research Code of Conduct, participants must understand all parts of the consent form in order to take part in a study. So the consent form, the short consent form, is what was part of the JotForm questionnaire, and that kind of outlined that the participant would not receive any compensation for participating, and that their information would not be disclosed, and no names and emails would be collected. And the long consent form basically made sure that the participant understood everything that was in the short consent form, and the long consent form is emailed to the participant. And then they move on to the eligibility questionnaire, which was designed to remove any outliers from the study. And these questions were based on the research from summer of 2021. As mentioned earlier, any participant with existing sleep disorders or regularly consumes alcoholic substances may not be eligible for our study because their sleep would be affected by other reasons, which is not the pandemic. And then we move on to the demographic questionnaire, which includes basic questions about the participant's background, such as their age, race, gender, and vaccination status. And we collected this information to make sure that our study was reaching a various populations, so that we had both male, female, and other, and participants of all different types of races. And then we move on to the sleep questionnaires, which had sleep questions about their sleep habits. And these questions were based off of the PSQI and ISI, as I mentioned earlier. And we converted all of their answers into numerical values by assigning numbers to them. So we had 0 for never, 1 for rarely, 2 for sometimes, and 3 for always. And in order to make sure that our study reached many different populations, we had a lengthy outreach process. So first we finished internal testing within our lab. We tested using vaccinated and unvaccinated data. And using that data, we polished our surveys and changed our tables, changed our questionnaire into a table format so that it could be completed faster. And then we drafted emails to remove bias or any content relating to vaccines so that the participant didn't understand why we are collecting this data. And then we sent our questionnaires to ASDRP faculty for the first round of feedback and testing. And then we sent it out to families and friends, posted it on online forums such as Nextdoor, Survey Circle, and Poll and Instagram. And then we started emailing college professors who focus on neurology and psychology. We also developed a flyer, which is on the right, and that kind of outlined basic eligibility qualifiers, as well as information about the study, including the length, which is around 10 minutes, and some contact information. And we also set up strict data managing and protection systems so that our data was protected within our lab, and we couldn't see any of the participants' personal data. We created tables within JotForm that automatically hide PHI data, such as names and emails, but also allowed us researchers to see SQI data, which was important to our study. And we also had an internal elimination process. So the forms were combined into one form to make it easier for the participant, but most ineligible people would be eliminated through the eligibility questionnaire, but sometimes data leads would have to look through the individual questions answers and perform quality control checks, because sometimes people would leave the questionnaire incomplete, or they would have the same response for all of our questions, which is not very helpful to the study, as that was common in some of the people who found our study through online forums. And now we're moving on to the results.
So first we had to start by doing some data analysis preparation, and we started this by using Google Sheets first, which is our current data recording platform. And through this, we had a t-test, which is a statistical test that compares the means of two samples, as well as a chi-square test, which is similar, but with two categorical variables instead of a dependent quantitative variable and an independent categorical variable. And we also had variance. And then now we are prepping our workstations or our personal computers for analysis using R in RStudio, Homebrew, Jupyter Notebook, and the latest version of Python. The reason why we switched from Google Sheets to R is because Google Sheets was only used as a quality control for basic data collection and for preliminary data analysis, but we're using R for more sophisticated and complex analysis of our data because it is a statistical language that will help strengthen results for our paper. Next slide, please. So for our actual data, 63.4% of the 71 eligible participants were female, and we had a total of 141 interested participants, and the average age of both female and male participants were 36.2 years old. And our correlation coefficients in the middle, it's 0.70. This goes from -1 to 1, and since our correlation coefficient is closer to +1, this means there is a strong positive correlation between our variables, and we can reject the null hypothesis, indicating that there is no significant difference between the two variables. For the actual SQI, the change was -3.69%, which means there has been an improvement from before the vaccination, where it was 29.8, to after the vaccination, which was 28.7. Next slide, please. And now we're going to be talking about some conclusions. So for future work starting now and ongoing until our project is completely finished, we, as Sahar talked about before, we submitted our abstract to SFN, which is a neuroscience conference, and we are pending approval into the conference. We also started our analysis, like I discussed before, using Jupyter Notebook and RStudio to analyze data patterns, which is going to help with our paper, with the production and publication, which we have already started drafting. And something newer to our team is causal modeling. And here we're going to be incorporating our data in a mathematical representation of the relationship between the variables. Next slide, please.
Thank you all for listening. We'd like to thank our current and past researchers and our principal investigators, Sahar Jahanikia, ASDRP, and the audience. We'd love to answer any questions through our email or right now. And these are our references.
Excellent. Bravo. Perfecto. Wonderful. I can't wait for all the good things happen to you guys, paper, conferences, and I'm looking forward for your advanced data analysis and mathematical modeling between the different sub-factors of sleep index. We'll see what will happen, and also with the demographic information that we have. A lot has done, a lot more is underway, but great work. So just I leave you to the audience if they have any question for you. Please don't ask about future works.
I have a question. So actually, it's two questions. So maybe you all remembered early in the days of the pandemic when the vaccines first came out, right? First, I think Moderna, then Pfizer followed very shortly after, and then Johnson & Johnson. And actually before that, AstraZeneca in the UK. And initially, the data from AstraZeneca was like, wow, this stuff works pretty well. And then the Pfizer and Moderna ones just blew things out of the water. And the Johnson & Johnson vaccine kind of fell a little bit short. And as people progressed, I think as the data came out that it was less effective of a vaccine, I wonder if that can be taken into account into this framework study that you're doing. The types of vaccine, and I also wonder how the timing of all of this changes some of the factors that we're talking about. Because I think on day one of Johnson & Johnson, people were fairly excited about it. It was a more traditional vaccination route, and it showed pretty good efficacy. And then all of a sudden, nowadays it's like less good.
Yeah, that's a very interesting comment. To answer the first part of your question, we did in the demographic questionnaire ask what type of vaccine they received, both for the first dose, second dose, and the booster. While we haven't done like specific data analysis on whether the different types of vaccines have affected sleep, we definitely can in further research.
Good. Yeah, I think the timing would also be interesting because there was a time maybe about last summer when the Moderna vaccine looks stronger than Pfizer. So it's just a lot of confounding factors. It's a complex issue, but it was an excellent presentation.
So to address a question in the chat that says, does the fact that the experimental data was sent out on the internet imply a certain economic stature, and also imply that the people have access to the internet and or a computer? Well, that's a great point. And the thing is that if they are in an economic status where they don't have access to digital devices, that also implies that their the forms of stress that they have is different from the pandemic itself, and the pandemic also impacted them in a different way. So I think that the vaccine would have also impacted them in a different way, and I wouldn't think that that's the point of our study. It's basically to address people whose sleep quality was directly impacted by the vaccine and improve their sleep quality afterwards. So I think that if they have a certain economic stature that they didn't have access to the internet or a computer at all, that would be a confounding variable.
I can go ahead and answer the next question that says, what machine learning algorithm are you guys planning to use in the future for data collected? So as Sahar said, for our future works, it's kind of in the air right now. We've just started using R and just got into our data analysis. So for future works, we're in the process of that, so we can get back to you on that later. But as of right now, the platforms that I did mention, which were R and RStudio, Homebrew, and Jupyter Notebook, those are the ones that we are currently working with our data for.
And the next question asks, I remember you guys mentioned asking about addictive substances. Were there any other similar questions you asked to get rid of confounding variables? And yes, we did. Some examples are our study only included adults over 18, so we did ask if they were 18 years or older. We also made sure that no one undergoing a pregnancy was participating in our study. Anyone who had any existing sleep disorders, and anyone with serious illnesses such as cancer and addictive substances, etc.
What was the main important one?
The main one that we discussed that I can remember is the healthcare thing and also night shifts.
Yes, good.
Healthcare, first of all, they would be required to have a vaccine, and that's part of their job and not because they think that it's better for their health. So that is a confounding variable that we seek to reduce.
So the next two questions kind of go together for employment status and comorbidities. Like if we took them into consideration, employment status was not entirely considered for our eligibility, but comorbidities, so like having more than one disease at one time, that was considered, especially if they had a sleeping disorder. I think Annika talked about that before, because if you already have a sleeping disorder, then your sleep quality will be worse, including like even if you had something that wasn't a sleep disorder, say cancer or some other sort of autoimmune disease, it's very hard to have proper sleep quality. So. Oh, and I think we had one more. Did these people make any changes in their life, like work out more, eat healthier after vaccination? So those are factors that we as researchers can't really take into account, because that's more of like a personal individual thing. We were taking into account the relationship as an entire group rather than individuals and what they're doing with their lifestyles. So we didn't address or ask any questions of, did you make any lifestyle improvements, because that wasn't entirely the focus of our project. But if anyone has any more questions, you can ask them out loud or in the chat.
Or if you think of them later, maybe we can screen share again to show our email, or I'll drop it in the chat as well. To answer the last question, I didn't understand what SQI entails. So SQI stands for Sleep Quality Index, and that's basically how we keep track of our participants' sleep quality. So as I mentioned earlier, the questions all have options such as never, rarely, sometimes, always. So those are given numerical values such as 0, 1, 2, and 3. So the sleep quality index is the sum of all those numbers, which represent how they answer the questions, and we compared them to before vaccination and after vaccination. I hope that answers your question.
Maybe give her a couple of examples. What is in the sleep assessment that we have run? Very few, about maybe napping, or remind me again, what was the categories we have in the sleep? Falling asleep, how many times you fall asleep, how many times you wake up, right?
Yeah, and there was falling and staying asleep. There were how many times you take naps throughout the day. And for that, it would be, if you do take naps more, then you would have like, it would be like, do you often fall asleep or like take naps during the day for more than 1 hour, I believe. And for that, we would have the always would make you have a higher sleep quality index, which means worse sleep quality, if I'm correct. I'm pretty sure I explained that correctly, but if that makes sense. If you need more clarification, we can give a more specific example. But for the next question that is saying, are possible seasonal influences accounted for, which would be allergies and exam, or well, for students, they weren't necessarily in our data collection. So our exam time, which is May, June, we wouldn't really be affected by this because we're not being collected, and our main groups that were being collected are adults. So exam season wouldn't really be something that can consider. And once again, like allergies and seasonal things are more specific to individuals than groups, and they don't entirely have as drastic of an effect of sleep quality as the pandemic did psychologically. So I'm pretty sure most of the questions of the confounding variables are things either we could not control or didn't have a relevant impact on sleep quality.
And to add on, in terms of the before and after vaccination, we didn't specifically say before or after vaccination because that would kind of give away the purpose of our study. Instead, we kind of brainstormed what the most common time it was for people to get vaccinated, which was around June of 2021. So we said, what was your sleep like before June of 2021 and after, instead of saying before and after vaccination. And to answer the data analysis and programming languages question, that's a part of our future work. We're looking at using R and Python. So we'll definitely look into what data analysis skills later on and get back to you. And for the correlation between a person's age and their SQI, we did look at that, but there wasn't a large enough correlation coefficient to come to a conclusion.
Yeah, that was one of the first things we saw, and there was no correlation between the two.
Okay, it's 7:30. If you have any more questions, they have provided their email address. Please reach out to them and bombard them with your questions and your curiosity. Thank you so much, everyone. Thank you, team. I'm so proud of you, all of you, and all my teams. But good luck with the rest of your team, with the rest of your project, and thank you.